Good afternoon. This is All India Radio. I am Valsa Williams and with me is Ishani Gupta with the Midday News. The headlines. Government says new guidelines to fight COVID-19 to come into effect from 4th May with some relaxations to many districts. Movement of stranded labourers continue in many states. J&K administration facilitates movement of 17,000 while Madhya Pradesh brings back 20,000 labourers. Academic session for old students to commence from the 1st of August and for fresh students from the 1st of September, says UGC. Rural Development Minister Narendra Singh Tomar says 33,300 crore rupees sanctioned under MG Narega. World Health Organization to convene an emergency meeting on coronavirus today. And veteran actor Rishi Kapoor passes away in Mumbai. President, Vice President and Prime Minister express deep grief. The Home Ministry has said new guidelines to fight COVID-19 will come into effect from the 4th of May, which will give considerable relaxations to many districts. The Home Ministry spokesperson said details regarding this will be communicated in the days to come. The Ministry yesterday held a comprehensive review meeting on the lockdown situation. There have been tremendous gains and improvement in the situation due to the lockdown till now. The Home Ministry spokesperson said to ensure that these gains are not squandered away, the lockdown guidelines should be strictly observed till the 3rd of May. After the Home Ministry's inclusion of new set of relaxation measures in the national lockdown guidelines, the states are gearing up to facilitate movement of stranded migrants, students, pilgrims and tourists, among others. Bihar, Jharkhand and a few other states have already designated nodal officers to prepare a register of such stranded people and are devising the standard operating procedure to be followed during their transit. More details from our correspondent.
People have welcomed Centre's announcement of allowing movement of stranded people starting from 4th May. The decision will address concerns of migrant workers, students, pilgrims, tourists and other people who wanted to travel back to their home. State governments are coordinating to allow movement of passenger buses carrying people stranded due to the nationwide lockdown. Seating arrangement in buses is being planned to ensure contactless travel. People who would be traveling are required to get themselves registered with the nodal officers in their state. Proper screening of passengers is made necessary both on commencement and completion of the journey. After journey, every traveller will have to stay under home quarantine. Government has also asked people to download Arogya Setu mobile app so that their safety can be well taken care of through technological intervention. Anand Chaturvedi, AIR News, Delhi.
In Madhya Pradesh, about 20,000 labourers stranded in other states have been brought back to the state so far. After conducting health checkups of all the labourers, they are being sent to their home districts. Around 1 lakh labourers from Madhya Pradesh are working in different states. Some of them have already returned to the state.
Additional Chief Secretary and in charge of the State Level Control Room, ICP Keshri, has told that about 7,000 labourers are being brought back from Rajasthan and 3,000 from Uttar Pradesh today. Action is also being taken to bring back 1,600 labourers from Goa. Bhaiyalal Lohani of Umaria district and Nawal Adivasi of Shiopur district thanked the government for bringing them back from Rajasthan.
डोडर के रहने वाले हैं, नागौर जिले में फंसे हुए थे और बसों द्वारा निकाले हैं, उसके लिए हमारे मुख्यमंत्री जी को हम धन्यवाद देते हैं और जो खाने की प्रबंध किया है इसको भी हम धन्यवाद करते हैं.
On the other hand, under MG Narega scheme, more than 97,000 employment-oriented works are being conducted in more than 22,000 panchayats of the state. Of these, 7,24,000 labourers are being provided employment. Additional Chief Secretary Panchayat and Rural Development Manoj Srivastav said that instructions have been given to all the districts to start employment-oriented work in the remaining districts except hotspots. Sanjeev Sharma, AIR News, Bhopal.
In Rajasthan, the number of corona-infected persons in state has gone up to 2,524, with 86 new cases coming to light today. In Jodhpur, 59 new persons tested positive today, taking the number of corona-infected patients to 472, while 14 new cases have been confirmed in Jaipur. 4 persons from Ajmer, 3 from Chittorgarh, 2 from Tonk, and 1 each from Alwar, Baran, Dholpur and Kota tested positive. About 5,000 samples are yet to be tested. Health Department informed that 827 people have been freed of corona infection in the state.
More than 650,000 migrants and workers stranded in other states and wishing to enter in the state have registered themselves. During the first phase, workers stranded in the temporary camps of the different states due to lockdown are being brought back. About 10,000 such workers have already reached various districts of the state. Workers of other states stuck in various districts due to lockdown are also being sent to their home states. More than 12,000 workers have been ferried up to Madhya Pradesh border in the last 2 days from Jaisalmer. The government has deployed about 1,000 buses for this work. In the second phase, migrants will be brought back from neighboring states. For this, discussions are being held with the state government. Jitendra Dwivedi, AIR News, Jaipur.
Uttar Pradesh Chief Minister Yogi Adityanath has appealed to the migrant workers of the state to have patience and avoid travelling by foot. Work of bringing back the labourers from Madhya Pradesh is in progress, and from tomorrow, migrant workers from Gujarat will also be brought back. UP government has written letter to other state governments and sought details of migrant workers.
UP government has prepared elaborate plan for the return of lakhs of migrant workers from other states. Details like name, address, medical report and mobile numbers of those migrant workers who want to return to their native places have been asked from other state governments. Chief Minister Yogi Adityanath has said that his government is in touch with other state governments and discussing the ways to send migrant workers to their native places, and meanwhile, they should remain wherever they are right now. State government has started preparations to deal with the situation after return of migrant workers. Till now, arrangement of quarantine centers, shelter homes and community kitchen for 6 lakh persons are in place. Expansion of level 1, 2 and 3 hospitals is on card, and beds in COVID hospitals are also being increased to 52,000. Sushil Chandra Tiwari, AIR News, Lucknow.
The Bihar government will form a detailed action plan with regard to return of migrant workers and students in a day or two. Deputy Chief Minister Sushil Kumar Modi said the state government will look into arrangement of transportation for stranded people based upon deliberations with respective governments. The state government will conduct screening of people coming to the border, and those showing any symptom of the infection will undergo through diagnosis and treatment. The Deputy Chief Minister said screening of stranded persons returning to the state will be done at the block level as well. Asymptomatic people will remain in quarantine centres for 14 days. People showing symptoms will be sent to Quarantine Facilities Centre. Deputy Chief Minister said the return of migrant workers and students will be done strictly in adherence of new guidelines and all required steps to prevent the spread of COVID-19 virus through returnees. In Jammu and Kashmir, the administration has facilitated the return of 17,000 labourers, students and other people from different parts of the country. Those brought back were kept in administrative quarantine as per protocol. More from our correspondent.
The stranded residents were brought back from Punjab, Himachal Pradesh and Rajasthan. Among them, around 9,000 persons were sent back to their homes after completing administrative quarantine of 14 days. The government has set up 4 big quarantine centres in Kathua and Samba districts for housing those coming from different parts of the country to undergo mandatory 14-day quarantine period. Besides this, interstate movement of 34,000 trucks carrying essentials was also facilitated during lockdown. The government has also set up a dedicated helpline centre in JK Resident Commission, New Delhi, to facilitate the return of JK residents stranded outside the country. Nasir Rathar, AIR News, Jammu.
In the Union Territory of Jammu and Kashmir, Srinagar District Administration has been tirelessly reaching out to the residents of the district in safeguarding their health care. It has issued the directions for the residents of Srinagar for mandatory use of face masks from tomorrow in an effort to prevent the spread of COVID-19 in Srinagar city. More from our Srinagar correspondent.
Srinagar District Administration has made it mandatory for the Srinagar residents to wear face masks from tomorrow. Those who violate the instructions will be dealt strictly with offences under Disaster Management Act. District Development Commissioner Srinagar Dr. Shadi Iqbal Chaudhary has said that the administration has procured 15 lakh face masks from several self-help groups. Up to recently, 8 lakh face masks have been received, while as the rest 7 lakh shall be received in the very near future. This is Sunil Kohl for AR News from Srinagar.
In Gujarat, the government today appointed nodal officers for various states to bring back stranded students, travellers, pilgrims and working professionals. The nodal officers will also ensure the smooth movement of people from other states who are currently stranded in Gujarat during the lockdown. The order has been issued as per the guidelines from Ministry of Home to facilitate the movement of people between states. A total of 16 senior level officers have been appointed in different states or groups of states who will coordinate with their counterparts and other departments including port and transport.
Around 4,000 fishermen from Andhra Pradesh who were stranded in Gujarat amid the lockdown were sent back home from Veeraval. An official said the state government arranged 60 private buses from Veeraval in Gir Somnath district to ferry the fishermen to Vishakhapatnam. The last such bus left for Andhra Pradesh yesterday. The University Grants Commission (UGC) has released guidelines on examinations and academic calendar for the universities in view of the pandemic and lockdown. The academic session 2020-21 may commence from the 1st of August for old students and from the 1st of September for fresh students. Intermediate semester students will be graded based on internal assessment of the present and previous semester. In states where COVID-19 situation has normalized, there will be exams in July. For terminal semester students, exams will be held in July. A COVID-19 cell will be constituted in every university, which will be empowered to solve the issues of students related to academic calendar and examinations. A COVID-19 cell will be created in the UGC for faster decision-making. Rural Development Minister Narendra Singh Tomar has asked the states and union territories to proactively implement rural development schemes relating to employment generation, rural housing and infrastructure development. He said the states should take all necessary COVID-19 related precautions while implementing their schemes. Mr. Tomar said this while holding a video conference with rural development ministers and concerned officers of states and union territories yesterday. He emphasized that under MG Narega, the focus should be on water conservation, groundwater recharge and irrigation work in convergence with the schemes of the Ministry of Jal Shakti and Department of Land Resources. During the meeting, he also informed the states that 36,400 crore rupees has been released in the current financial year to them. He said the Rural Development Ministry has also sanctioned 33,300 crore rupees under MG Narega, out of which 20,624 crore rupees has been released to liquidate all outstanding dues of previous years towards wages and material. This sanctioned amount is sufficient to meet expenses under MG Narega till June 2020. The Union Minister assured the states and union territories that sufficient financial resources are available for different rural development programs.
A total of 33,050 confirmed cases of COVID-19 have been reported in the country so far. As per the Health Ministry data, out of the total cases, 8,324 patients have recovered and been discharged from the hospital so far, while 1,074 patients have died due to the disease. With this, now there are 23,651 active COVID-19 cases. Indian Council of Medical Research (ICMR) has said that a total of 8,30,201 samples of COVID-19 have been tested by the various government and private laboratories in the country so far. ICMR is continuously scaling up its testing facilities for COVID-19 by giving approval to government and private laboratories. As of now, 292 government laboratories and 97 private laboratory chains have been given approval to conduct the test for COVID-19.
Over 3,25,000 people are using Jan Aushadhi Sugam mobile app to access Jan Aushadhi Kendras. Amid the nationwide lockdown due to COVID-19, Jan Aushadhi Sugam mobile app is helping people in a big way to locate their nearest Jan Aushadhi Kendra and availability of affordable generic medicine with its price. The app has been developed for facilitating the general public by providing a digital platform at the tip of their fingers. It is available on both Android and iPhone platforms and can be downloaded free of cost by the user from Google Play Store and Apple Store. Presently, more than 6,300 Jan Aushadhi Kendras are functioning across the nation, covering 726 districts of the country. In our series Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Talking to AIR News, Dr. Uma Kumar, Head of Rheumatology Department, AIMS, requested people not to self-medicate or use hydroxychloroquine without prescription if they have symptoms of coronavirus.
I would request the people not to use hydroxychloroquine if they are having symptoms suggestive of coronavirus infection. This drug also has certain side effects, so it should not be taken by oneself, and it has to be prescribed by the physician or the treating doctor if at all it is required.
Dr. Sanjay Pandey of GB Pant Hospital, Delhi, said it is a matter of study how the hot weather in India will impact the spread of COVID-19.
This is also a respiratory virus, and this may also behave in the same way. But at the same time, it should be very clear that this is a new virus, and it's very important that before making a final conclusion, we should study the pattern of this virus in different parts of the world. So right now, we cannot make any definite conclusion, but I think with time, we will be able to know that how much impact the hot weather in India will make the difference in the spread of the virus.
You are listening to the Midday News on All India Radio. A reminder of the headlines before we move on. Government says new guidelines to fight COVID-19 to come into effect from 4th May with some relaxations to many districts. Movement of stranded labours continue in many states. J&K administration facilitates movement of 17,000 while Madhya Pradesh brings back 20,000 labourers. Academic session for all students to commence from 1st of August and for fresh students from 1st of September, says UGC. Rural Development Minister Narendra Singh Tomar says 33,300 crore rupees sanctioned under MG Nareka. World Health Organization to convene an emergency meeting on coronavirus today. And veteran actor Rishi Kapoor passes away in Mumbai. President, Vice President and Prime Minister express deep grief. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
दर्शकों का पसंदीदा धारावाहिक श्री कृष्ण जल्द आ रहा है डीडी नेशनल, फ्री डिश और अन्य डीटीएच चैनल पर। सब्सक्राइबर्स अपना चैनल नंबर नोट करें। फ्री डिश 001, टाटा स्काई 114, एयरटेल 148, सन डायरेक्ट 302, वीडियोकॉन D2H 149, डिश टीवी 193 और डेन 138। आगामी आकर्षण धारावाहिक श्री कृष्ण।
The World Health Organization (WHO) will convene an emergency meeting on coronavirus today. Director General Tedros Adhanom Ghebreyesus said yesterday. Executive Director of the WHO Health Emergencies Program, Michael Ryan, said he hopes that the much talked about drug remdesivir and other drugs prove helpful in COVID-19 treatment. WHO declared the COVID-19 outbreak a pandemic on March the 11th. According to the statistics collected by Johns Hopkins University, more than 31,50,000 coronavirus cases have been recorded globally. Prime Minister Narendra Modi yesterday had a telephonic conversation with his Bangladeshi counterpart Sheikh Hasina. The two leaders discussed the regional situation in the wake of the COVID-19 pandemic and briefed each other about the steps being taken to mitigate its effects in their respective countries. Both leaders expressed happiness at the progress made in implementing the special arrangements agreed on the 15th of March between the leaders of the SAARC countries. Prime Minister also thanked Sheikh Hasina for the contribution of $1.5 million towards SAARC COVID-19 Emergency Fund. Prime Minister Modi, recalling the shared bonds of history, culture, language and fraternal ties, expressed satisfaction at the excellent state of bilateral relations. He also ensured India's readiness to help Bangladesh in containing the spread of COVID-19 and in mitigating the health and economic impact of the pandemic.
In Telangana, the youngest COVID-19 patient so far has recovered and got discharged from hospital. A 45-day-old infant and 13 other children below 14 years have recovered from COVID. Our correspondent says the state authorities declared him as the youngest patient recovered in the country.
The country's youngest COVID-19 patient, a 45-day-old baby boy, has recovered from Gandhi Hospital in Hyderabad. The baby boy from Marlu village in Mahbubnagar district came with a complaint of loose motions initially, but he was tested positive for coronavirus and had to admit to the state-run Gandhi Hospital in Hyderabad when he was 23 days old on 10th of this month. Initially, doctors surprised as the infant's mother tested negative to the virus, but later found out that the infant contracted infection from his father. Now the infant is safe and healthy after treatment for COVID-19 for over 20 days. Lakshmi, AR News, Hyderabad.
In Andhra Pradesh, the number of corona-positive cases has gone up to 1,403 with recording of 71 more cases in the state. As per the health bulletin of the state government, of the total cases, 321 patients have recovered and been discharged from various places in the state during the last 24 hours. In all, 1,051 persons are under treatment across the state in various hospitals. The North Coast district of Srikakulam has reported 5 positive cases and there is no hike in the cases in the district during the past 24 hours. Another North Coastal district, Vizianagaram, has not reported a single case till date. Kurnool district has the highest number of positive cases with 386 and Guntur has 287 positive cases. In Karnataka, 22 new corona-positive cases were reported today, taking the total number to 557, which includes 21 deaths and 223 discharges. Maximum number of 11 cases reported from Belagavi today are secondary contacts. The Health and Family Welfare Minister B. Sri Ramalu will inaugurate 17 blood donation points in Bengaluru today to tide over shortage of blood. The Red Cross Society will also launch a helpline number for the donors to call up to donate blood. The Rural Development and Panchayati Raj Principal Secretary L.K. Atik has informed that Karnataka stands third after Chhattisgarh and Andhra Pradesh in generating employment under MG Narega program.
A class 10 student from Kendriya Vidyalaya Rameshwaram in Tamil Nadu has appreciated the commencement of online classes. The classes take place from 9 a.m. to 2:30 p.m. and have been started so that the academic calendar does not suffer due to the COVID-19 outbreak.
Soumya of class 10th, studying in Kendriya Vidyalaya Rameshwaram. Due to this coronavirus, our schools has not been opened. From April month onwards, our school has started online classes. Because of the online classes, we are able to continue our studies. For these online classes, there is a certain timetable for this. From 9 a.m. to 2:30 p.m., we have been studying continuously. We will mark down our doubts, and our teachers will clear our doubts through videos.
In Maharashtra, the total number of COVID-19 positive patients is inching close to the 10,000 mark. At present, there are 9,915 COVID-positive patients in the state. In Mumbai alone, 6,644 cases have been registered with 270 deaths. In all, 432 people have succumbed to the disease in the state so far. Meanwhile, in order to make optimal use of time, the state government is urging pupils, parents and teachers to make maximum use of e-learning platforms. More in this report.
Maharashtra continues to remain the hotbed of COVID-19 cases in the country due to relentless increase in cases in Mumbai, Pune and Malegaon. In Nasik district, the number of people testing positive for the disease has gone up to 276 with 71 new cases. Most of these cases are from Malegaon itself. The new patients include 6 police personnel and 3 children. However, the Maharashtra government has urged students, parents and teachers to embrace various e-learning platforms and applications to learn and to impart education. The government has also urged to make use of Diksha e-learning platform, which provides more than 9,000 educational material in Marathi, English and Urdu for class 1 to 10. Kunal Shinde, AIR News, Mumbai.
In Uttar Pradesh, Agra Smart City has created a GIS dashboard which will show various hotspots, heat map, positive cases and recovered cases. GIS stands for Geographic Information System. The dashboard will be updated on daily basis. Some of the features of the dashboard include heat mapping, date-wise and zone-wise analysis, infection and recovery trends. The Assam State Disaster Management Authority has engaged 14,000 citizens as Pratirodhi Bondhu to fight against COVID-19. Pratirodhi Bondhu are working as volunteers in creating awareness, including social distancing across Assam. One such volunteer has been assigned to reach out to 100 families in his or her locality. The volunteers are also extending online support to the people. Official sources said that citizens between 18 to 50 years have been deployed as Pratirodhi Bondhu.
1.85 million metric ton goods have been delivered in Northeast by the railway during lockdown. Talking to AIR News, CPRO of the Northern Frontier Railway, Shubhanand Chanda said that out of total goods, 1.05 million metric ton goods were essential food. He also said that apart from food items, coal and petroleum products have also been carried. Mr. Chanda said that during the lockdown period, track maintenance work have been intensified. He said that around 30% more maintenance work has been done during this time in comparison to last year. He also said that 90,000 face masks have been prepared for the railway staffs in Northeast. 441 Lifeline Udan flights have been operated to ensure delivery of essential and medical supplies across the country. 237 of these flights have been operated by Air India and Alliance Air. Civil Aviation Ministry said Lifeline Udan flights are being operated to transport essential medical cargo to remote parts of the country to support India's war against COVID-19.
Veteran actor Rishi Kapoor passed away in Mumbai this morning. He was 67. He had been admitted to a city hospital yesterday. After the sad demise of the actor, his family has appealed to his fans, well-wishers and friends of the family to respect the laws that are in force. A statement issued by the family says, in this hour of personal loss, they also recognize the world is going through a very difficult and troubled time. There are numerous restrictions around movement and gathering in public. Therefore, all fans, well-wishers and friends of the family are requested to respect the laws that are in force. More from our correspondent.
Rishi Kapoor, the most romantic face of Bollywood. He made his first screen appearance as a child artist in his father Raj Kapoor film Shri 420, where he appeared in the song Pyar Hua Ikrar Hua. He received the National Film Award as a child artist for Mera Naam Joker. But it was in 1973, with the blockbuster Bobby, again directed by his father, that he made his debut as a romantic. Filmfare Lifetime Achievement Award in 2008. He won the Filmfare Critics Award for Best Actor in 2011 for his performance in Do Duni Char, and for his role in Kapoor and Sons, he won the Filmfare Award for Best Supporting Actor in 2017. As his family states, he remained cheerful and determined to live to the fullest right through 2 years of treatment.
सभी इंसान एक जैसे ही तो होते हैं, वही दो हाथ, दो पाँव, आंखें, कान, चेहरा, सबके एक जैसे ही तो होते हैं। फिर क्यों कोई एक, सिर्फ एक ऐसा होता है जो इतना प्यारा लगने लगता है कि अगर उसके लिए जान भी देनी पड़े तो हंसते हंसते दी जा सकती है।
माधुरी पांगे, AIR News, Mumbai.
President Ramnath Kovind expressed condolences to the family members and friends of actor Rishi Kapoor on his untimely demise. Vice President M. Venkaiah Naidu also expressed his deep condolence at the sudden demise of the veteran actor. Prime Minister Narendra Modi has expressed anguish at the demise of Rishi Kapoor. Information and Broadcasting Minister Prakash Javadekar expressed condolences to the actor's family. Congress leader Rahul Gandhi also expressed his condolence on the sudden demise of the Bollywood actor. And now, before we end the bulletin, the headlines once again. Government says new guidelines to fight COVID-19 to come into effect from 4th May with some relaxations to many districts. Movement of stranded labourers continues in many states. J&K administration facilitates movement of 17,000 while Madhya Pradesh brings back 20,000 labourers. Academic session for old students to commence from 1st August, for fresh students from 1st September, says UGC. Rural Development Minister Narendra Singh Tomar says 33,300 crore rupees sanctioned under MG Narega. World Health Organization to convene an emergency meeting on coronavirus today. And veteran actor Rishi Kapoor passes away in Mumbai. President, Vice President, PM express deep grief. And with that, we